60%. So most women who are at the highest risk, if they have a genetic mutation, frequently choose to have this surgery. However, if you do remove your ovaries, that means you will go into menopause at an early age, and that could potentially increase the risk for other medical conditions. So it's a balancing act, and it's important to figure out which women should have their ovaries removed, and second, when is the ideal time for that to happen? It's pretty clear that the benefits of removing the ovaries outweigh the risks if women do have a genetic mutation. So there are women who don't have an identifiable genetic mutation, but they might have a family history of ovarian cancer. So that it may or may not be beneficial. It's important to talk to your doctor about that. But these graphs show you the risks, particularly for women with BRCA mutations, as Dr. Sutphin had described as the most common reason for hereditary ovarian cancer. The graph on the left shows the average age of diagnosis for women with BRCA1 mutations, and the graph on the right shows the average age of diagnosis for women with BRCA2 mutations. So as you can see, on the bottom of the graph there, it shows the age that these diagnoses occurs, and most of these ovarian cancers are happening over age 40. Therefore, most healthcare providers will say you don't need to interrupt your plans for having children. You can have your ovaries removed after childbearing is complete, and ideally this is sometime between the age of 35 to 40, and that will also help to maximize any kind of breast cancer risk reduction benefit you get from the surgery. But before you make any decision to remove your ovaries, it's really important to understand what menopausal symptoms you might experience. You don't want to be blindsided with side effects after the operation,